Good evening, everyone, and welcome to Series 134 of the Africa Healthcare Network Fireside Chat Series. Once again, we would like to thank the International Paediatric Nephrology Association to collaborate with the Africa Healthcare Network for the presentation of these sets of research webinars, of which today we will be having the second set. And this is in preparation for the IPNA 2025 Congress in Cape Town, South Africa. And the aim of these webinars, again, is to encourage junior career researchers in Africa and beyond to develop research questions and ideas, perform robust research, and prepare abstracts for the 2025 IPNA Congress, and also to develop mentor and mentee relationships. We will have two moderators this evening. The first one being the great Professor Mohammed Hani Hafiz. He is the Emeritus Professor of Medicine and Nephrology at the Cairo University in Egypt. He's also the President of the Africa Society of Nephrology and Transplantation and the former President of the Egyptian Society of Nephrology and Transplantation. He is also Chief of Nephrology Council of Egyptian and Arab Boards, and also the Middle East Counselor to the Declaration of Istanbul Custodian Group, the DICG, and the Secretary General of the Middle East Society of Organ Transplantation, MESOT. With him, we will have Dr. Peace Sigwadi, who is a pediatric nephrologist at the Unitas Netcare in Johannesburg, South Africa. She has previously done her undergraduate training at the University of Limpopo and her pediatric specialization at the University of Pretoria. I would like to welcome you both to carry forward with the presentation. Good evening.
Thank you very much. It's my great honor to be with you. Thank you, Dr. Ammar, and thank you, Dr. Lloyd, for this invitation. And it is my great honor to be among my prestigious colleagues, pediatric nephrologists. Always the AFRAN is very happy to be in the same congresses with the Pediatric African Association. It has been this for many congresses before, and I think we will continue to have this conjoint cooperation all the time. And my great congratulations for Professor Mignon for hosting this International Pediatric Congress in South Africa in 2025. It's an honor. We are all proud in Africa by this great achievement. Today we have a very distinguished speaker, Professor Peter Nourse, who is an international figure in the field. He is the first author of the latest International Society of Peritoneal Dialysis Guideline for acute PD in children, and he is also affiliated to the Division of Pediatric Nephrology, Red Cross War Memorial Children's Hospital, School of Children and Adolescent Health, University of Cape Town, and he got fellowship in pediatric nephrology from the Netherlands. And he will be speaking, his main research interest is peritoneal dialysis and acute kidney injury. But today he will be speaking about something more general, what is a good research topic. And I think this is very important for all of us, including those who are going to publish in different international journals. So, Professor Peter.
Thank you very much, Hani. Thanks very much. It was a great conference we had in Cairo. I really enjoyed that, and well done for organizing such a fantastic event. My topic today is what is a good research topic, and I think what we really need to do is think of it in context of what we're doing here. What we're doing here is trying to encourage probably young researchers and people from Africa, pediatric nephrologists or healthcare workers, or even adult nephrologists, to present something. And we've got to think of the fact that we've got about a year and a half to go. So we need to think of research topics that are possibly feasible in this time frame. So this is kind of directed more at young researchers, and trying to encourage people to actually do something for IPNA 2025. So you might ask yourself, well, why bother with research at all? I mean, you could just come to the conference and why bother doing some research? Well, I think the one thing is that funding opportunities, certainly from our university, if you would like to apply for funding for Congress, you often need to be presenting something. So a poster or an oral presentation would be good enough for us, and then we can actually attract funding for this thing. Another reason would be maybe I think most of us in African countries have quite a heavy clinical load, and most of us aren't primary researchers. I actually see it as a bit of a hobby, so you can actually do some research, it's something different, and it can actually be interesting. Another reason might be that there are questions in your community that need answering, and this might be the right time to actually try and address these things. And then possibly also another reason, it can actually forward your career. So you start doing some research. It's nice to network with people doing similar type of things, and that can actually be quite a good reason. First thing is you probably need to find something that you're interested in. And I actually asked ChatGPT what they thought would be a good one. And they said the foundation of a successful researcher in medicine is a deep-rooted passion for the subject matter. Begin by reflecting on your interests within the field. Consider the areas that genuinely excite and inspire you. Research becomes a fulfilling journey when it aligns with your personal and professional passions. Well, I thought that was a bit cliched and cheesy, but probably it's actually quite right. I think if you're going to do research, then you should at least find it interesting and to stimulate you to do further research. So, I mean, for example, this Norwegian research in 1994, and I actually found this study on PubMed, did the study on does garlic protect against vampires, an experimental study. And I think you probably struggled to get this one accepted as an abstract at IPNA, but still, this person was obviously passionate about this idea. And I suppose, by the way, the actually apparently it doesn't protect against vampires. It actually attracts vampires. So just in case you wanted to know. So for the next thing is to narrow down your focus. What is your question? That's the main thing. So when you're doing research, you need to say what question are you actually trying to answer? And once you've sort of decided on an area, a good idea is to read recent reviews and studies from reliable sources, read peer-reviewed articles, and try and read multiple sources to try and get an idea about what are the actual questions that need to be answered in that specific topic. So what type of study you're going to do? So you can obviously all different types of studies. There's randomized controlled trials, there's case control styles, there's retrospective studies. But I suppose if you're thinking of doing a research topic, I would say that probably a retrospective study, if you haven't started anything yet, and you need to get it through your ethics clearance and everything by early 2025, I would say probably a retrospective study. So, for example, this study by patients of the outgroup who looked at the burden and severity of deranged electrolytes and kidney function in children in a tertiary hospital in Kano, northern Nigeria. Patients was actually a fellow with us in Red Cross. And so she actually, this is a good study because she had all the data was available. It was retrospective, so she could go and look at the data. Except that I must say, patients, this study was, I had like 2,000 patients or something, and so it's probably not something achievable, but the fact that it was a retrospective study, I think made it easier. And the data was there available and it was not expensive. So another thing to think about is, is the study going to be relevant to a community that you're working in? And I think that for me is very important. If you're going to do research, it needs to try and be beneficial to your community. For example, this was a study done by a friend, Chris Esesabo in Nigeria. And it was basically a survey looking at, found that the managing of nephrotic syndrome in Nigeria varied widely and did not comply with the best interest. So it was very useful because it was a starting point to say that actually we're not treating the same, and Chris has actually gone on to do a lot of other work in nephrotic syndrome, much more complicated and thing. And so this was a good topic because it was actually a good starting point, and it showed that there was a problem with the treating nephrotic syndrome. So this is also another thing, is to find the solutions that are feasible in your environment. So this is another study actually done in Nigeria where in Nigeria, they actually have not got peritoneal dialysis catheters to do acute peritoneal dialysis. And they've been using chest drains to do peritoneal dialysis. And in this study, it was a retrospective study, and it just showed basically that using these chest drains, they actually had saved a lot of children's lives and had quite a good outcome, and the peritonitis rate was reasonable. So I thought this was a very useful study because it actually found a solution in a country for a region that was actually very relevant, and it was also something that you could do retrospectively, didn't cost you any money. So I think that was quite important and a good example. Another thing is to choose something that's, I think, common in your area. So this is amazing. So this study came from Uganda, and they looked at black children with malaria, which obviously have a lot of children with malaria, and they looked at children with black water fever, and they see what this would predict outcome on significance of acute kidney injury. I mean, they actually recruited like 900 children with black water fever. So that's something that you couldn't really do in many parts of the world. So it is really unique, and that's research that is very unique to that area and relevant to that area, and it couldn't be done anywhere else. It's not something you could do in England or anywhere else like that. So I thought that was quite a good example. I would think this is probably not such a good example, and maybe I'm wrong, but this was like a urine-based detection of biomarkers indicated of chronic kidney disease in patient cohort from Ghana. So this is patients, doctors in Ghana who are collaborating with European doctors, and they found that maybe these biomarkers did indicate chronic renal disease. But this is really like something, you know, these biomarkers are expensive. They're not really going to be rolled out in Uganda, and they probably did or didn't predict chronic renal disease. I would think things like dipsticks and blood pressure are more important. So for me, I mean, maybe I'm wrong, but this is, for me, this is not necessarily such a good example of research that's relevant for your area. This is actually another example of research. So study came from Cameroon, and I'm sorry I'm talking about dialysis a lot and acute kidney injury, but that's sort of my interest. And in Cameroon, there was not actually peritoneal dialysis fluid available. So these doctors actually have been making their own peritoneal dialysis fluid. And this is a very useful study because they showed that if you use, you make your own fluids, they looked at the outcome and the peritonitis rate and found it very favorable, and it was a very useful study. And I think this would be a good study because it's retrospective. The data is all there. It's achievable within a certain time frame, and it doesn't cost you anything because you just have to look at the data yourself. So I would say something like that would be a very good example of a study to do and send to IPNA. Right. So the next thing is that if you're going to be doing a study, you need to remember that you need to have ethics clearance, and most reputable journals, or all I say, would not publish papers without some sort of ethics approval. So before you actually start or embark on any kind of study, remember that the ethics, you need to have ethics clearance. And there are a number of things to think about in an ethics, when you're doing ethics clearances. So most of the ethics sort of concepts are based on the association of the Declaration of Helsinki, which are the ethical principles for medical research involving human subjects. And there have been many iterations you can see over the years for this, but it's worthwhile if you're going to do research to get up to date with what the principles are of these. Most places you'll have to do in South Africa, we call it a good clinical practice course, which is you have to do one every 3 years in order to do research on human subjects. So, and whether or not you actually have something like that in your country, that's important. I think it's important just to do the research in line with these kind of principles. So worthwhile reading these articles and other ones if you're going to do research. So remember, if you're doing a clinical trial, most clinical trials, so say that probably a clinical trial, if you haven't started it by now, is not something that you're going to get achieved by the time we have IPNA. But if you are down the line, remember that before you actually start a clinical trial, a lot of journals will actually want you to have registered this trial before you start on the clinical trial registry. And there is actually a Pan-African clinical trials registry, which is quite useful and maybe not as complicated to register on as some of the other clinical trials registry. I actually recently did a clinical trial where I registered my clinical trial on this Pan-African clinical trials registry. And remember, if you are reporting clinical trials, then there are guidelines, like, for example, the consort guidelines on how to report your information on a clinical trial. And this is quite important to know. So when you're actually writing the article or writing the even just the abstract, to know that there are these guidelines on how to report these things. So remember, conflict of interest is very important when you're doing studies. So you need to be aware of conflict of interest, and you need to at least declare any conflict of interest up front. So conflict of interest in science refers to situations in which financial or other personal considerations may compromise or have the appearance of compromising an investigator's professional judgment in conducting or reporting research. And so this is very important to be aware of. It comes in various forms. So it may be sponsorship for a pharmaceutical company. It might be that you're getting financial gain. It might be professional conflicts of interest. So in other words, maybe you're getting a promotion by doing this research, or there may be personal conflicts of interest. In other words, you may have some sort of religious or other belief that would make you want to get a positive outcome with your research, or there may be personal conflicts with other researchers. So these are all things to be considering when you're doing research. And the main thing is that it doesn't mean you can't do any of the research, but you do need to declare the conflict of interest when you're presenting the research or when you're writing it up. So for example, this comes from our ethics committee, and this is a statement on conflict of interest. So for example, they say, I or a member of my immediate family do not have any interest related to this research, either financial in the sponsor of the research or intervention, or they say I and my family do not have any proprietary interest in the product being tested in this research, for example, patents or trademark or copyright licensing agreement. They also say that I and my family do not have any relationships related to this research, for example, board membership, consultative, executive employment, or any other entity with an ownership interest in the research other than the relationship of sponsor-investigator. And then finally, also, I or my family or business will not receive any payment when enrolling or participating in a study. So just if you are doing research and you have got some conflict, just think about these things before you proceed. And then the next thing is, so what budget do you have? As I say, if you're going to be doing a retrospective study and the data is all there, or the information, the data is all sort of available, it's probably not going to cost you. I mean, it may actually just cost you nothing. But it's very important, you might just be say, photostatting something or copying something. You might have to buy programs or apps or something for the study. So I think the important thing is to work the budget out before you start, so that you're not halfway through the study and then find that, okay, no, you actually have to stop because you haven't got any more money left. And the other thing is to make sure the funding comes from a reputable source. So that is quite important. I mean, I think we're quite desperate for funding often, but it won't really do if you have a dodgy funder. And then once you've decided on a research subject, I think it's important to collaborate and seek mentorship. At least, once you've got an idea and a topic and maybe you started writing a protocol, it's very important to run this by your colleagues or your mentors. And you can actually also find people on the international stage who are often very willing to help you. I know Valerie actually has been great with us at Red Cross, and she's got a lot of experience, and she's been very good with actually helping us, just get an idea properly what research we're going to do and sort of designing the study properly. And then also helping a lot with actually the final writing up of the paper. And this is very important. So just remember, it's actually, you might think that people won't help you, but actually you'll be surprised. There are lots of people out there that will, if you approach them, they will be more than happy to actually help you with something. Next thing is statistics. So remember, done quite a bit of reviewing of articles for journals, and because one of the things that people fall short on is the statistics, and so it's very important to get this right from the beginning. Get the statistician involved right from the beginning. If you haven't got one, maybe you can get someone online to help you, but don't try and do a study and gather data and then try and retrofit statistics to the study. So you need to know beforehand what your outcomes are going to be, and then decide how you're going to compare the different things of what statistics you're going to use. And so this is often people fall short on this thing, on statistics. So really start from the beginning. Before you even start collecting the data, you need to know what you're going to use, what statistics you're going to use for looking at the outcome. So other things to consider, and your ethics committees might be asking you about these things. The one thing is, are there any vulnerabilities associated with the proposed participant group? So is this a vulnerable group of patients? Actually, usually children are described as a vulnerable group of patients, and you might need to motivate and justify to your ethics committee why you want to include children, which I think is usually quite easy because adults are not children, so you can usually justify it by saying that you need to do studies on children. But you also need to think of the other pre-existing physiological or health conditions. Are there cognitive or emotional factors, socioeconomic factors, or legal status that make this group of patients vulnerable in a research study? And this is something you need to consider when you're doing a study. All right. So if you are doing a study, remember that if you have questionnaires or forms, or even the consent for the study, and if you're going to get the right information, you need to make sure that it's in the language of the patients. As you can see from this slide, a lot can go wrong in interpretation and translation, and so it's very important to actually to do this and make sure you get someone, because a lot of us come from areas where there are lots of different languages spoken. So try and get your consent forms in languages that are like translated into the language of the patient. And also if you're doing questionnaires or CREs, you need to actually get those translated so that the patients properly understand what the questions are and what information you're getting. Otherwise, lots gets lost in translation and comes out strange. Another thing you need to consider is what about data storage. So this is important. You need to know what measures will be taken to protect the individual privacy and the confidentiality of the data. So generally speaking, you need to have it on maybe on an Excel spreadsheet, which is protected with a password, and on a computer maybe that's protected with a password. If you in the cloud somewhere, there needs to be some sort of protection of that data so it can't be hacked, and that the individual's privacy is protected. Often, what a study will require is that you actually you disassociate the patient's name to the data. So you might have the names of the patients on one list with numbers, and then the numbers on another list with the patient's data. And you also need to just decide how you're going to store this data and how long it's going to be stored for. Often studies, a lot of time you might need to keep that data for a while in some sort of studies. Another thing to consider is the level of risk associated with research. So you need to decide the probability and magnitude of harm for the participants. For example, are there going to be side effects? Are there cognitive or emotional factors such as stress, anxiety? You need to consider socioeconomic or legal consequences of research, such as stigma, loss of employment, deportation, or criminal investigation. And these are things to consider when doing research. So it's basically what risk the patient is at. Another thing to consider, and we have to do this at our university, is that the participants, this is if you're doing prospective studies, generally, or clinical trials. So the participants and the researchers need to be insured in case things go wrong. We're lucky that our university actually insures the researchers, but this is also something in your context that you might have to think about. All right, so thank you. I think that's all I've got to say. And I'd like to hear from the panelists now. They can any comments and maybe contribute something. But thank you very much, and we look forward to seeing you at IPNA Cape Town 2025, hopefully with some research. Thank you very much.
Thank you very much, Professor Peter. It was a fantastic lecture. Thank you very, very much. Could I ask you a question regarding the ethics and the point of that you just mentioned, causing no harm to in the research itself. So I think the ethical committee will not give the approval if they think that there is a possibility of harming the candidate during I mean, it is the same point, right?
Yeah, I think it is the same point. And I think, probably at your university, your ethics committee has very strict rules, and they will look into that. I think for some people, maybe in other parts of Africa where maybe they haven't got such good ethics committees, it's something they're going to probably have to think about themselves.
Yeah.
And might have to actually make that call on their own, I think.
Thank you very much, Peter. It was such a wonderful topic. If you look at the progression from August, with our August webinar, where we were talking about introduction to research, conducting successful research in Africa, and scientific reading and literature review. Today we learn what is a good research topic. One of the interesting things you said was that the study needs to be beneficial to your community and do what works in your community. It's such a wonderful statement. And I think it was such a good talk. Anyone with questions?
Yeah, thank you very much for that. I think that's the, that for me, if we're in Africa, we need to find solutions for Africa as well. Like to do research with high-end, very complicated, expensive things that are not really going to be implemented in our countries. I feel that should be sort of secondary. So thanks, Patience, for bringing that up.
I see hand raised, Dr. Francis.
Yes, hello. Yeah. Thank you, Peter, for this talk. This is really excellent. Yes,
long time.
Thank you for the talk. Yeah, long
Pleasure,
time indeed.
yeah.
And
yeah.
I think this is excellent, and basically I think it is also reiterating the fact that all the clinical work that we are doing, we are collecting data basically, and we have possibility of using all this data that we are always collecting. So I usually look at our clinical experience and day-to-day activity as one way of, as an important database that is always somewhere that people can really go back and look at it and use retrospective design to document this data. And of course, it is a good way of auditing what you're doing. because you always have children that are coming in with malaria and you're treating them, but you might not have look at how many of them had acute kidney injury and what was the outcome, you know. So if you organize yourself and look at this data retrospectively, you might be able to say a lot about the patients that you're seeing. So I completely agree with you, and I believe that auditing the data that we have at the moment might be a good way of going. Thank you so much for the talk.
Thanks, Francis.
Professor Valerie.
Lovely to see you.
Thank you. Professor Valerie.
Thank you. I just have a very quick comment. I think that was fantastic. And I thought all the examples were really great because you really showed how people are actually showing what they're doing in their real lives. Just one quick comment, because I totally agree with Dr. Francis about, using the data we're collecting every day. The one thing is just, if we're thinking of doing this prospectively, we should get ethics right at the beginning and consent patients, because I think sometimes we get ethics approval to go retrospectively, but then the data is not very complete. So just in your mind, I think if you're planning something, it's easier to think ahead, plan the ethics and get consent. But even if you want to look at retrospective data, you will still have to go to the ethics. So just, I think all phenomenal comments. I just wanted to comment just about that, because sometimes then you're stuck. You want to use the data, but you can't always use it retrospectively unless you have consent.
Yeah, I think you're right. And I think that's why sometimes maybe registries are quite a good idea. If you have a kind of a registry of data you collect, so that it's more complete, even if you're not sort of thinking of a study, like just sort of collect the same data on the patients that you're seeing. So then that data is often more complete, even if you're doing it sort of retrospectively.
Yeah, I think it's such a good idea. I wonder if among the audience, we've got people who have got some ideas regarding the research topics that they may be interested in or that they are thinking about, so that we can just stimulate this discussion.
I was suggesting that we make some collaborative work through AFRAN, studying one item in different countries, because in this way we may get very interesting data. For example, we study one question and try to address this question in different countries. One protocol, and all of us we work on it. I think this will gather very interesting.
I've lost Hamdi now. Are you guys hearing him?
Yeah, I've
Lost him.
Okay. No, I think he was talking about collaborating, which is obviously a good idea. And for example, we're doing this nephrotic study in H3 Africa, nephrotic study, where we're looking at the topic all over Africa, collaboration with people from North America. And obviously the data is better. I think just the problem with that for IPNA in a way is just the time factor.
There is a question in the chat box about, can a title present as a question example? Why is UTI more common in children? So I think those are some of the topics that we should help each other so that we can create a research question surrounding that.
Yeah, I agree.
So one of the examples I can also give from my side in our area is we had a lot of children who had COVID, and we also had a lot of kids who had PIMS in our society, and majority of them had AKI. So one can phrase a question about what was the impact of COVID in our transplanted community among pediatric patients. Or one can come about what was the outcome. All the patients who had PIMS, if you follow them up over a certain period of time, and you look at those who were on dialysis and those who were not on dialysis, who just had AKI that was treated conservatively, how many of those remained with a normal renal function? I think those are some of the questions one can look at.
Okay, that's a good example.
I was asking if we can make a sort of collaborative study between different countries or between different areas in Africa. For example, like the study of Apple gene in different areas, East versus Central versus North or versus South Africa, and see if these genes are in different places are the same or not. Something like this would have more impact internationally. What do you think? Because I think when each country makes only its local studies, it does not have an international impact like when we make a sort of collaborative work together.
Maybe Valerie can answer that question. What do you think, Valerie?
You put me on the spot. I think Sarala is actually there. She put something in the chat and she's actually worked on APOL1. But I think, the biggest thing is exactly sharing ideas and then discussing with people and then figuring out, first of all, I think one needs to go back and see, has it been done? And, Sarala, I think can answer. I don't know exactly if this has been done in different areas of Africa. And then obviously try to figure out, who would want to work with it, who would be able to, who would one need to collaborate with, where would one get funding, these types of things where it would involve genes is probably pretty expensive. I think part of what Peter was also discussing was that there's a lot of things, as Francis also said, that one can do without too much money. So I think one can think on both sides, but maybe Sarala can answer the APOL1 question. You're muted again, Peter.
Sarala, I think you've been unmuted, so if you could answer that question, it'd be great. Thank you.
Thank you. What I wanted to say was that I agree with Professor Hani, and it doesn't have to be just genetic studies. Any study, if you want power, if you look at the US-based studies, for instance, or European studies, I think they get published in really high-impact journals simply because of the power of their study population, many, many thousands. So if you go with small studies, single country or 1 or 2 countries, we don't have the same same impact. And so therefore, I think that, say, if somebody wants to study AKI or whatever topic, it'll be nice to have a good representation from different regions in Africa, and we can look into how to get the funding. And as already was discussed, you don't really need huge funding for some of the studies, especially if the data you're collecting is part of standard of care. As far as our APOL1 studies go, I mean, basically you need the expertise, technical expertise to do the genetic studies, number one. And secondly, you need a very good an analyst who can actually analyze what the data means. And those were all learning curves for us. And we're lucky that we had really good collaborators in the US in the form of Cheryl Winkler and her colleagues. So we really did well. But I think one of the problems with our studies was that they were single country or single center based, whether the studies were done at Wits or Nigeria or what. So I think we'd have done much, much better if we could have included, people from other countries and other regions. Thank you.
Thank you.
Thanks, Sarala. That's great.
I think this will be one of the tasks of the research committee of AFRAN to try to cooperate between different countries and suggest protocols to be applied in different places. I mean, this is the main job of research committee, and I hope you will help them, Professor, with your talk and idea of how to tailor the subject or how to select a good study subject to be applied in different countries. The research committee of AFRAN itself.
Yeah, okay, thank you. That's a good idea. Yeah, I think it varies a lot. You get these big studies which take much more planning, have much more power and more likely to be more impactful. But, like for people who may be living in Cameroon or somewhere, they can just really start with what they've got, with the retrospective nature and things that are relevant in their community. I mean, like there's one study from Uganda where they actually collected 900 patients with 900 children with black water fever. I mean, where else could, that's quite a big study and probably not where you could do, not something you could do in many other places really. Yeah. So I think you've got these, I think we really should collaborate and do bigger things, but we can also do the small studies as well. I think are quite useful, especially in pediatrics where there's not really that many numbers. See, there's some other questions here. In a retrospective study, are there risk to participants who are involved in the study? If yes, tell us how. If no, tell us how. So I guess the risk to participants in a retrospective study is much less, but there are still risks because you are collecting data on patients, and if there is a breach in the data, then those patients are at risk of their information being open to the public or to whoever else. So there are still risks even in a retrospective study to participants. Definitely. I don't know if you guys would agree with that. Anything else there?
Hello, everyone. Hello, I've been unmuted. I'm Dr. Rasha Darwish. First of all, I'm very happy to see all of the people that I admire, Dr. Hani, Valerie, and Dr. Peter. I mean, thank you so much for this gathering. I just wanted to to tell you that actually we are trying to make a multi-center study in Afran and the PD committee. We have done that. We have done a protocol, and we are targeting several countries. We are trying to make a study which will not be costly, just a simple study on probiotics in the peritoneal dialysis patients. And targeting several countries, we had an amazing response. I mean, so far we have about 5 to 6 countries in Africa who are willing to participate. So it's feasible, but again, the problem is always financing. What we are trying to do, we are ready, we have the centers, we have the protocol, we have the idea, but it's always about who will be there to support us financially. So this is the question I'm raising. Can't we have a clear target to approach to finance such studies?
Does Valerie or Hani want to answer that question?
The problem, Professor Dr. Rasha, is that usually pharmaceuticals and the industry is not interested except if they have maybe some drug or some of their products included in the study. But in general, they don't support financially like this. And you know, nowadays all over the world there is some economic restraints. So
yes,
I don't have a clear solution for this actually.
Can't we target the UN or WHO? I mean, don't we have a say in that to try to talk to them, especially when we are talking about a simple, I mean, we're talking about probiotics, they're not expensive and they might make a difference. So can't we just address them?
Of course, the UN and all these have other priorities, and maybe Dr. Valerie could correct me in this. We are facing, for example, these disaster stories in Sudan and in other places, and I think they are prioritizing this aid to research for the moment, and even for to get enough funds for the disasters is difficult. So I think we should try to depend on maybe the research committees of each country if they are making a sort of budget for the research. This could be the way, but for the moment, I don't think. Maybe I think Professor Sarala wrote something that she can answer you.
Yes, please,
Professor Sarala, please.
Yeah. I was saying if you basically only need the money for probiotics, and you've identified which probiotic you need, maybe to approach the sort of global pharma who's responsible for it. Because I know when we've done some interventional studies, like looking at ACE inhibitors in the days, you know, a specific ACE inhibitor that wasn't on our, on our hospital-based formulary. So the company actually came to the party and donated, you know, like a 2-year, 1-year supply that we needed it for the number of patients. So sometimes you know, instead of asking them for money, you can ask them for product.
Yes, okay, it's a very good angle, but I hope that they'll be interested in providing, especially if they are selling their products anyway. I mean, the angle is how to approach them. Yeah, I mean,
let's have to make it very exciting for them.
Yes, exactly. How to sell our idea. Yes, exactly.
Yeah.
We'll try to. Thank you, Prof. Sarala.
You're welcome.
Thank you. There's another question on board. It says, in case of mortality registry, how do you suggest on getting consent? Can you use patient relatives to provide consent? Can someone answer that for us? I suppose consent must be given, but by who?
Repeat that question.
If I may answer.
Yeah, go for it, Sarala.
Yeah, in our experience, if we do that sort of study, usually it's retrospective, and it's very difficult to get hold of patient relatives, which is our first approach. Is the family available? Can we contact them? And if we can't, then usually we get consent from the hospital CEO or superintendent, and we have to show them, you know, that we have tried to get hold of relatives. Then generally they've been quite easygoing, and our ethics committee, which is also very, very strict, has accepted that approach.
Professor Sarala, I'd like to direct one question to you from myself. In cases where the study is going to be done in a private setup, do you necessarily have to collaborate with one of the universities?
Oh, no, not at all.
So can you go as an individual to the ethics committee and they accept you without the backup of the university?
No, absolutely. As long as you have a good proposal and you show that you've gone through all the ethics hoops that Peter has mentioned, there should be no reason why not. Because I've had colleagues who are doing, like say this cardiologist that I know, who's looking at aortic dissection, and he's already published one paper and he's busy setting up a registry, for instance, and all from private practice without any university affiliation.
Thank you.
I see Valerie just wrote a topic about collecting data for advocacy, like tracking access to dialysis. Valerie, do you want to just elaborate on what you mean there?
Yeah, what I'm actually just, what I think is, that we did these these systematic reviews on access to dialysis in Africa and basically put together all the little papers we could find. And, these things were actually very, very useful. And we were able eventually to get into a good journal. But I think, small things like this is just to say we had, 100 children who presented and we could only dialyze 30 of them. This is extremely important information because then you can go to your policymakers and you can tell them, this is not acceptable, etc. So, I think these types of studies for me are very worthwhile. And I think sometimes if it is mortality, if you're really looking back and you just say, we had 100 children and 30 of them died or whatever, as long as you're analyzing them as a big group and you're not individually reporting data that someone could then identify a child on the, in a table, let's say, a child with one leg and HIV and, I don't know, something else that someone could really understand, that this was a specific child. Sometimes you can get a waiver of ethics from the ethics committees, but my feeling is I think a lot of you are struggling every day with challenges. You're trying to get medicine, you're trying to get access to dialysis, you're trying to get people to come earlier to the clinic, you're trying to, do whatever. And I think about these daily struggles that you have and collect them, because I think you can first go to your CEO, but if you publish it, and the Afran journal, for example, is open access, so then you can disseminate it as well. There are other journals that are open access, but I think these things that you struggle with every day, just sit down and try to think, how can I collect this information and put it in a package that then I can actually show somebody that we have a problem and this needs to be fixed. That would be that to me is a good reason for a study. I'm sorry, we're talking too much. I think the participants should speak.
There's one that says, what are the procedures that should be followed if you want to publish a research work?
Well, I think Valerie would be the best person to answer that, maybe, or Hani, or Sarala. Valerie, do you want to give it a go? I think getting ethics. We've got to the point of getting ethics, but then what happens after that?
I think there's a whole series of webinars in this IPNA teaching thing, right? So I think there are a whole lot of things. I'm not sure if maybe the organizers have a list of all the topics, because maybe that hasn't been circulated to everybody. And so we are hoping that each one of these webinars will actually tackle one problem. I wonder, Lloyd, do you have something that we could show on Ashton?
Yes.
Or Ashton, if
I don't have it right now to show, but I will circulate this across the board. Certainly will circulate it. Yeah.
I'll have a peek as well. I think it might be on my desktop. Can I try to share?
Yeah, please. Yeah, I'm on the phone.
There we go. So, I think the point is here, for example, today was how to choose a topic. Next one on the 28th, so that's next week, is study methodology. Then ethics of research is going to be a specific topic. Then data collection, results and discussion, how to write things up, and also how to do a conference abstract, and then how to develop a visual abstract, because a lot of times now if you publish in a journal, they want a visual abstract. So I think this was all part of this brainchild of Ashton and Mignon and Peter, I guess, coming together to try to really do something systematic and quite quickly, as you can see, by the end of November, so that people will have thought about their projects and maybe even start thinking about it to be able to submit. Then I believe in May is the abstract submission. And I think for the abstract submission, you don't have to have written the whole paper. you know, when you submit to the conference. I think you just need to submit the basic outline. But, you know, I think there have been a lot more questions today than last time, which is great. But just that everybody knows, you know, there's other topics coming in the next couple of weeks.
Thanks, Valerie. That's useful. Yeah. All right. Is there anything else we need to cover, or any other questions, or are we going to call it a day?
One of the problems.
Africa
One of
has
the problems. Go ahead. Please go ahead.
Okay, Africa has diseases which are peculiar to this region. I wish we had an African ethical committee somewhere that would minimize difficulties when it comes to doing research across the region. Such a nice wish, and I also wish the same.
So I'd say that the one thing is that we have actually got an African journal, you know, the Afran journal, which is an open source, open access journal. And it is somewhere that you can actually publish your work. I assume that if you're saying we had an ethical committee, is that you don't actually have one at your university, which I find, yeah, it must be quite difficult then if you don't actually have an ethics committee, then you need to actually think of these things yourself. And I don't really know what the way around that is. You know, the ethical principles are always the same. It doesn't matter what research you're doing, but the principles remain the same. So as long as you stick to those principles, I don't think it really matters too much about what the topic is. So that kind of those principles can fit to most topics. I don't know if you guys would agree with that, but it must be quite difficult if you don't actually have an ethics committee.
I think Professor Valerie is asking if most places have ethical committee. As you mentioned, most universities have their ethical committees, and they don't allow a research to be done except after passing by the ethical board. So most of the researchers are going in this way in each country. I mean, like this. So they gather the data, they see the process, they are assured that the consent is given, they are assured that there is no harm by the procedure tested. So ethical committees look to these, and all medical faculties have their ethical committees. At least I'm speaking for Egypt, for example, and I think it is the same condition in many places in South Africa and in many other places.
Sarala, do you want to say something? I see you got your hand up.
I just wanted to add that even if you're doing a multi-center or multinational, international study, most institutions want their local ethics committees to look at it. And looking at sort of things that aren't university-based, I know in South Africa, the Medical Association has an ethics committee. And I know in some other places, the local medical associations do have some ethics committees. But I saw Valerie's suggestion. That's something that can be easily done. We can run a sort of short questionnaire to find that out. And some countries would accept ethics that has been granted, you know, as a blanket ethics. But as I say, I know in South Africa, each institution wants its own ethics, institutional ethics.
Okay, well, I think that's maybe a study that someone can do with Valerie very quickly, and that we could present at IPNA possibly.
Thank you very much. I think we have already gone. It's now 7 o'clock. I'm not sure if we are still going to go ahead for another hour, but it was such a wonderful meeting, wonderful participation, a very interesting topic from you, Peter, and we really appreciate it. I would like to thank even all the participants who came to join us in this journey embarking towards IPNA 2025 in Cape Town, and we are very excited about this for the first time in the African ground. So thank you very much for attending, and we really appreciate all of you.
Thank you very much.
Thank you.
On behalf of AHN, we'd like to thank everyone on the IPNA panel for taking your time out and being with us this evening. And thank you to IPNA again for helping us arrange such a high impact talk from Professor Peter. Just a couple of announcements before I hand over to Dr. Lloyd. The first one is that the first part of this series is available on the YouTube channel, Africa Healthcare Network Fireside Chats. That was by Professor Valerie. Dr. Lloyd, could I have you take over for the vote of thanks?
Extremely grateful. It was a wonderful session, as already mentioned by Dr. Patience. Thank you, Professor Hafiz, and also Professor Peter, and all the panelists for this. A lot of discussion that has occurred, and actually a lot of clarifications on, especially the ethics, which is actually quite a challenge when you're coming to multiple countries. The ethical clearance from each country is time consuming, and sometimes you also have finances involved when you submit the claims to the ethics committee. So I think it's interesting, and it would be really nice for the Alpha Research Group to actually take up a multi-centric project or a simple topic, and that would be wonderful indeed. Thank you very much for this great evening and your time.